Okay, welcome students. So welcome one more session of PYT of medicine, previous year topics, high level topics. One of the doctor has asked me about pandas, right? So just 1 minute. Sir, what is meant by pandas hypothesis? Please explain, sir. He asked. Doctor, pandas hypothesis is important, but if you ask me in medicine, okay, but still I will explain, right? Okay, then let's go. After that I will discuss, right, why I gave a question mark. Okay, so we will discuss the pandas hypothesis with the help of this MCQ, then it will be easy for you. Okay, pandas hypothesis has a subset of children with a rapid onset of schizophrenia, mania, OCD, that is obsessive compulsion disorder, or hysteria. If you know the answer, you just think for it. If you don't know the answer, just sit silent for 5 seconds. Okay, everyone okay, ready with the answer? Okay, we'll get the answer after the explanation. Okay, so what is pandas? First you should know the full form of pandas. Pandas means pediatric autoimmune. I think my marker is not going as perfectly as I think. Okay, neuropsychiatric disorders associated with streptococcal infections. Now this is what is called pandas. This is the full form. See, pandas is actually a theory. It is just a theory, or you can also say it is a hypothesis. Means it is just a hypothesis that is being imagined. It may have some evidences or may not also, but we will see what actually a panda is. It is actually a simple pediatric assessment. Always remember, it's just a pediatric assessment, nothing much. Okay, so what it is doing, it has some sort of symptoms which is regularized in the form of a criteria. So it has a symptom criteria. Now what are those symptoms? There are abrupt severe symptoms. Now if you ask me what are those abrupt severe symptoms, something like anxiety, if the children have anxiety. See, these pandas deal with the pediatric group. I think you understood with this definition only. Pandas is dealing with pediatric, not geriatric. Adults will not come here, only children. Okay, so if they have anxiety, if they have behavioral abnormalities, that is behavior regression or developmental abnormalities, then if there is any deterioration in the school performance, or if there is any emotional lability, or if there is any irritability, aggression, oppositional behaviors, sensory or motor abnormalities, and sleep disturbances, enuresis, and or increased urinary frequency. So these all come as a abrupt or severe symptoms in the symptomatic criteria of the pandas. But if you ask me what is the actual criteria for pandas, the major general criteria for pandas, the first criteria is abrupt onset of OCD, obsessive compulsion disorder, or tic disorder. Okay, now second one is, it's actually a prepubertal onset. But if it's acute onset, it will be of an episodic course. Right? So episodic course means here it defines there will be relapsing and remitting, but not wheezing and warning. It's not wheezing and warning. It's relapsing and remitting. And there will be also association of neurological abnormalities. Neurological abnormalities. Okay. Now, if you ask me what are those neurological abnormalities, it will be something like coliform movements, hyperactivity, handwriting changes, all this sort of accompanying things. Now, there will be a small temporal relationship. There will be a small temporal relationship between the symptoms that are exacerbated and the streptococcal A infection. Now, this is the main important statement. First one is tick disorder and symptoms and streptococcal A infection. Now, will you surprise if I tell you like streptococcal A infection as well as other infection, they can trigger what they can trigger, what the capacity they have to trigger, they can trigger sudden onset OCD. Will you believe this? Streptococcal A infection and other infections sometimes trigger the sudden onset OCD, and also sometimes they also develop some neuropsychiatric symptoms. Right. Now, what are the symptoms that are included in the sudden onset OCD? Right. Something like if the symptoms which include sudden onset OCD and or you can take anxiety along with at least 2 or other following symptoms which I write down here. The first one is sensory sensitivities. Second one is separation anxiety. Third one is sleep difficulties. Fourth one is personality changes. Yes, some children also affect with the personality changes. Fifth one is urinary frequency, increase in urinary frequency, or enuresis also can be seen. Then it will be something like tics or abnormal movements, as well as irritability or aggression, and inability to concentrate, or you can also define it like ADHD, attention deficit hyperactivity disorder. What is the drug of choice for ADHD? Methylphenidate. Please remember. Okay. Now there will be also a deterioration in learning abilities as well as developmental and age regression. Now, as we already discussed, this PANDAS is a hypothesis. It's not a sure shot theory with a static results or with a static evidence. It's a hypothesis, means children will be having some neuropsychiatric disorders which may link to the streptococcal A infection as well as some other infections also. Right? It's just a hypothesis. So there will be a subset of children who will have rapid onset of OCD. This is the answer. The children will have rapid onset of OCD or tic disorders, and these symptoms are caused due to group A beta hemolytic streptococci. That is what we define it as PANDAS hypothesis. Psychological symptoms, if you ask me, all I have given: obsession, compulsion, repetition, anxiety, fear, panic, emotional, visual or auditory hallucinations. See, visual or auditory hallucinations also present, and also suicidal tendency also occur in these children. Okay, depression and suicidal tendency. Now, physical symptoms may simply include all the tics, unusual movements, sensitivity to light, sound and touch, deterioration of small motor skills or poor handwriting, hyperactivity, ADHD, memory problems, refusing to eat, joint pain, everything are present in so-called this PANDAS hypothesis. Now remember one thing, I just want to say this thing. This was given in one of the medicine's textbook, not Harrison's. But children with PANDAS, they will not always have these symptoms. No, they don't always have these symptoms, right? But they generally have a mix of physical and psychiatric symptom. So that is why the main reason that we call it a hypothesis means because we cannot make a confirmatory or static or solid evidence that the group A beta hemolytic streptococcal infection or the infections like these conditions might land up the children into OCD. No, there is no static or solid evidence, but still most of the physicians, they consider this hypothesis, Panda's hypothesis. Okay, everyone okay? Understood? Okay, so we'll come with one more important PYT in the next session. Thank you.